Welcome, everybody. By the way, Lucas, I heard a new word today. It's called doable. That's the word of the day. That was your best word, and so I appreciate that. Thank you guys for having me. I will tell everybody that it was fun for me to listen to Lucas because I find myself, Lucas is beginning his career, and it's just so cool to see the young generation getting ready because the old guy is tired and the old guy needs to slow down. And so, when Allison and the team asked me to hop in here, first of all, love it. Absolutely love being in front of the new generation, and you guys are so cool. I thought, what can I share with you guys today? Allison calls me the pain person. That's kind of morbid because I'm not just a pain person, but that's what people know me as. But what I want to do this afternoon, if you're okay with it, I kind of want to look back almost 30 years ago. Yes, I'm old. I told you guys I'm old, but kind of like what have I learned in the last so many years? Because what Lucas was discussing was actually pretty cool because it's things that he's getting ready to experience. And what a cool thing to go through a residency and training and classes. I've probably done, and now I'm on the other side of the spectrum. And so I want to share that. So I hope if everything goes well, I can share with you guys my little PowerPoint. And I'm an educator, which means we do create PowerPoints. And so we have to share it. So I hope everybody can see. Allison, maybe you can give me just a thumbs up that
Yeah,
it is
you're
sharing.
you're good.
Okay, awesome. So if everybody's okay, I'm just going to run through it. It won't be long. I'm not lecturing to you, please. It's a Tuesday afternoon. Sorry, Wednesday afternoon. We're having a bit of fun. And I appreciate it. I know it said physical therapy 101, but I know we have our occupational therapists here. So I just quickly changed the slide. It's therapy 101. What have I learned in the last 30 plus years? Well, first of all, I learned we need a new journal. It should be the journal of don't need to study anymore. I think there's some seriously cool things we learn every day that a lot of cool clinicians and your CIs and any clinic you go to, there's a lot of experience in the clinics, which I think is absolutely amazing. And I want to just quickly share with you guys just high level things that I think is absolutely vital that shows me you're in the right place at the right time. I cannot emphasize that enough, be it a PT student, PTA, OT, CODA, no matter what, we're at the right time at the right place. Um, First rule of medicine, do no harm, right? And I love it because Lucas even mentioned this idea of medical screening, etc. We have to understand that when people come to us, we got to be safe. It's not just physical, right? As we move into biopsychosocialism and our occupational therapists are so good in behavioral medicine, we also have to make sure that people are safe when they come to us from a physical perspective, but also psychologically, right? Maybe they have some depression or some trauma issues, etc. So what do we do first? Make sure they're safe, make sure they should be here. And if not, let's get them some help. And we're very good at this. I need you to understand that. We are really good about making sure people are safe when they come into our clinics. The second thing, and it resonates with everything I do in my life, and that is just educate, teach people. This supercomputer that all of us have on top of our head has about 86 billion neurons making 5,000 to 100,000 connections. And this supercomputer has one job to do, and that is to keep you alive. It'll do whatever it can. So it needs information to make decisions. And we now know from some incredible science that if the brain feels threatened, it doesn't know what's going on in my back, what's going on in my knee, what's going on in the carpal tunnel, it'll produce pain to protect you, to get your attention. And that is the essence of things that we call pain science or pain neuroscience education. So, depending where you practice one day, just sitting with a patient and make the unknowns known. Hey, Susie, what do you know about your knee? Or what have you been told about your shoulder? And just trying to educate them and educate them along with all the cool physical stuff we do. Provide prognostication. People need to know where they're going. We need to give them timelines. This beautiful idea that tissues heal. I don't know if you're aware of it, but it's been studied. The most powerful words in medicine, you're gonna be okay. Now, I don't take that very lightly, and I don't just loosely walk around and say, you're gonna be okay, you're gonna be okay, right? What's the first thing? If people are safe, we know they need to be in therapy, they're in the right place at the right time, they don't need to see the doctor, they don't need an x-ray, they're safe. There is such a cool thing about being a therapist by telling people, based on the stuff that we see every day, back pain, neck pain, knee pain, ACL, whatever, most people are going to be okay. Some people just take a little bit longer than others, etc. But this is incredible reassurance. You're going to be okay. As a therapist, that's for me the coolest thing, to walk up to a patient, put my hand on their shoulder and say, you know what, Frank, you're going to be okay. All right, we're going to get you through this. And I think it's one of the coolest things we can do in rehab. That's why I love being a therapist. I don't deal with the very threatening, life-threatening stuff typically. I deal with, good old musculoskeletal pain, which is very common. Promote self-care. I'm probably going to get a lot of guff for this one because I know, right, our current models are fee for service and people come, we bill them, and they go home, etc. But there is still this incredible cool thing in therapy, and that is about telling somebody, you're okay, you can go home. You're okay, you don't need more therapy. And I still believe one of the coolest things in my whole professional life is when a patient drives past my clinic on the way to their daughter's softball game or to their son's basketball game because we win. We made them better. And the cool thing is if I do my job really well, he or she will know to come see me when they need me again. But what a great thing, right? Getting people to a level where they can go back to the thing they want to do. Again, just a beautiful thing about being a therapist. This is truly one of the most heartwarming things for me being a therapist. Move people, right? I hope you will remember from today, and I hope nobody came to, find some sayings or stuff to get a tattoo or something. But these are cool ones. Motion's lotion and rest is rust. As a therapist, you should memorize those, right? I'm going to write your names down. So if I catch you somewhere at a conference, I'm going to ask you, what are the two sayings, right? Motion is lotion, rest is rust. As a therapist, you should be salivating right now because this is what we do. This is our mantra, right? Move, move, move. As a scientist, a neuroscientist doing research in this area, I just want you to know that the maps in our brain, they alter within 15 minutes. It's real quick. So if we don't move, they alter. And when they alter, they actually can drive pain, which means move, right? Motion is lotion, rest is rust. And again, as a therapist, this is great news. We should move people. They should move post-op, post-injury, get them moving as quick as possible. Fear. If you see this beautiful quote, this is a famous quote by Gordon Waddell, the late Gordon Waddell in Pain Journal 1993. You've heard this one before, I'm sure you have, but that's where it's from. The fear of pain is worse than pain itself. We encounter a lot of people in rehab, no matter where you practice, that walk in with a lot of fear of movement, fear of work, fear of a lot of different things. By the way, fear of therapy. And we have to reduce fear because fear predicts pain. Fear predicts disability. And again, it ties to beautifully things I've told you before, this idea of you're going to be okay. Let's make sure you're safe. These things beautifully tie together. And I think it's cool. I love the idea that a human being can come and see us. They walk into our clinics, don't know much about therapy. They're very fearful. They don't know much about ACLs. They just had surgery. And we can interact with them for that 20, 30, 40, whatever minutes we have. And then after that, they are so calm, they go, I'm going to be okay. Yes, you are. I think it's one of the coolest things we can do. And so again, it's reassurance, all those neat stuff. By the way, Lucas was talking about it, and Dan was referring to it, this idea that, when we encounter people, it comes from so many cool things but it's calming them down is a critical element. How patients experience success. The cool thing is, guys, this brain of ours is plastic. There's so many of the systems in our body that are plastic. Bioplasticity, neuroplasticity. Our brain has 125,000 miles of wiring, replaces itself every 3 weeks. You know what that means for a patient? Hope. The most powerful thing you can do in this world to change a person's life in therapy is to give them hope. You mean this can change, Adrian? Yes, ma'am. You mean I can get better? Absolutely. You mean I don't have to be like this forever? Nope, you can get better. What a great thing, right? Because it's based on science, and you just create this incredible hope inside of them. And what a great, great, wonderful thing we can offer our patients. Perform skilled physical exams and tell them. I mean, I love it. What Lucas was discussing there is working on your skill. Now, I'm kind of being a little naughty this afternoon. You'll notice I said there, be good at your craft or leave my profession. And I want to be serious about that because you should have pride in your skills. You went through school, you paid a lot of money, you're working on your skills, and when you graduate, awesome. But work on your skill. I mean, you joined this club called therapy, right? How cool is that? But work on your skill and be good at it. Why? Because our patients know if you're good at it. I can honestly tell in all the years Allison is here and Dan is here, they'll tell you when you take a patient's arm or their leg in your hands, within a split second, that patient can figure out if you know what you're doing or not. And how do you do that? You work on your craft. Work on your craft. My favorite therapist at a weekend class is when that therapist has been practicing for 10, 15, 20 years, 30 years, and they still work on their craft. That is beautiful. And we should, because that's really what it is. And our patients want it, by the way. Number 9, focus on the biology of the nature of the problem. What I mean by that this afternoon is no syndromes. Complex regional pain syndrome doesn't tell me much about what's wrong with me. Syndrome kind of sounds like a cyborg, right? Low back pain just means I don't have upper back pain, and low back pain doesn't mean I have low front pain. Our patients, it doesn't make a lot of sense. So we do sit with them and teach them about their back, teach them about their neck, teach them about pain. So when they walk out of your clinic, your department, they go, you know what? I know more about what's happening with myself. How cool is that? Getting closer to the end. Don't worry, I don't have 400 of these. Not even close. Reduce pain. The biggest predictor of chronic pain we've ever studied is the intensity and duration of acute pain. Now, I'm going to get a lot of guff for this one, and that's okay. I get a lot of emails every day. I've listed a few things on this list. It doesn't mean it's the only things. But there's a lot of cool things we can do in therapy that takes somebody that walks in our clinic with a lot of pain and for them to leave 30 minutes later, 40 minutes later and say, I'm better, right? Unloading an area, giving somebody a cane, a brace or something, high velocity thrust, the spinal manipulation. The research is stunning for acute non-radicular pain, dry needling, ice, e-stim, slowing down those kind of signals coming in. Very, very powerful for us, all right? Handful and we're done, all right? Minimize the number of healthcare contacts with healthcare personnel. I'm sorry, I'm not trying to be contentious this afternoon, but the more people we see, the worse we get. If you see 7 doctors, 3 chiropractors, 8 therapists, 9 that, we get more opinions, more injections, more drugs, and it just doesn't help us much, right? What does it mean? Be good, get them better, and get them on with their life is really what we do. And I'm a big fan of the PT First movement, this idea of if you start in therapy, you can probably end up in therapy versus if you start in the imaging side, you're probably gonna get more imaging, more surgery, more drugs. And that data is unequivocal. We've proven that, right? So the idea would be, yes, we work with others, you'll see in a minute, but we also make sure let's get away from us a little bit. Let's go get on with our life and go walk and go exercise and do the cool stuff. You can come back later, but let's get you better. Multidisciplinary treatment. We don't have all the answers. I hate to tell you this afternoon. I don't have all the answers. I don't think Allison has. I don't think Dan. Maybe they do. But the more complex condition you have, the more help we need. We do work with physicians. We work with pain doctors. We work with dietitians. We work with psychologists, psychiatrists. And the more complex it gets, the more help we need. And we need to all play nicely in the same sandbox. And it's pretty cool, by the way. When we start working in a community, right? You join a clinic, but suddenly you start working with the doctor down the street, and there's a psychologist 2 doors down, and there's a nutritionist a couple of blocks over that can help you. Very, very cool to build these communities where you practice. Manage and identify relevant dysfunctions. Just remember, there's a lot of people with bulging discs and people with overpronation and short legs and long legs and oblique pelvis. If you find it, work on it, make it better, but keep moving on, right? And all it means is we're going to find stuff, work on it, but don't get stuck there. Let's work on getting people better, which kind of ties to the next one. And I got 3 more and I'm done. I'll be done this afternoon. I don't want to get Dan to be mad at me. It ties probably closer to something called lifestyle medicine. As you work longer over time, you're going to probably figure out you move from a fixer. When I was a young therapist, I was fixing people because they're broken. They're not broken, but they need to be coached. They need to be educated. We need to move them, educate them, cool things. And you'll see such an incredible interest now in things like sleep, sleep hygiene, nutrition, mindfulness-based stress reduction. I love where we're going. And by the way, our younger generation is way better than this. As oldies, we didn't know a lot about this stuff early on. We're learning a lot about it. So you guys are beautifully set up to handle these patients. And then the last one, as I finish off real quick, is reaching for the patient's goals, right? I know we got to write SMART goals. In therapy school, you're taught about SMART goals, right? We need to have these measurable goals, attainable goals, all these different one, time sensitive, whatever. But you got to do something that makes the patient really want to get there. I know this isn't popular, but I always tell people if I can reach behind the patient's back, flip the switch and say, what would you do now? What would you want to feel better? And they say, well, I would dance again. I would start my night classes for my nursing degree to then get to the thing they really, really want to do. That's the magic. When they see that hope, like, oh, I can go back to class. I can raise my kids. I can go back to work, those kind of cool things. So there we have it, some musings from from an older therapist that I think has practiced for quite a while. I hope that helps a little bit. But it was really cool for me to listen to Lucas, and I think we're going to listen to Zach in a minute. I hope this helps a little bit. Maybe I didn't learn anything in 30 years, and I got to redo it again. But that's what I learned in the last 30 plus years. So, Allison, Dan, I hope that worked.